You are the FI1 working on a general surgery ward. One of your patients, a 65-year-old man with a history of gallstones and Pick's disease, frontotemporal dementia, has been admitted with right upper quadrant pain, vomiting, and a positive Murphy's sign. Your consultant thinks that a laparoscopic cholecystectomy is the most suitable method of management in view of his recurrent admissions. Choose the 3 most appropriate actions to take in this situation. A. Ask the family and carers to come into hospital so that you can have a discussion with them about surgical management options. B. Ask the sister on the ward to come with you to consent the patient for surgery. C. Ask your registrar to ring up the family and carers so that they can come in for a discussion about appropriate management. D. Assess the patient capacity to make the decision about whether he wants surgery or not. E. Explain to the patient, his carers, and relatives what the surgery would involve, including the risks and benefits. F. Put the patient on the list for surgery the following day. G. Speak to the patient about the procedure and prepare a consent form for your consultant so he can consent the patient after his clinic. H. Tell the carers and relatives that the patient is going to have surgery, as this is what is in his best interests. Answer: ADE. This question deals with the issue of a patient who may lack capacity. You must remember that you should always assume a patient to have capacity. In order to assess capacity, the patient needs to be able to understand, retain, and weigh up the information given to them, and then also be able to communicate a response to that information. Capacity is also decision-specific, meaning that every time a new decision is made, capacity must be reassessed. For this reason, in this situation, it is necessary for you to assess capacity, D, as it would be inappropriate to assume this without an assessment, as in options F and G. If a patient does lack capacity, it is advisable to contact those closest to the patient so that a decision can be made in the patient's best interests. Options A and E are therefore also the most suitable responses in this scenario. It would be inappropriate to simply inform the relatives and carers about the planned therapeutic course. H, as this would not demonstrate collaborative decision-making, nor can you assume that this would comply with the patient's wishes. Option B is not appropriate as you, and the ward sister, are unable to consent for a procedure that you're neither trained to carry out nor to consent for. In addition, this assumes capacity in a patient with severe dementia. You're also not involving those closest to the patient, which is equally important in difficult situations such as this. Asking a colleague to telephone the carers, C, is unnecessary because, as an FI1, you should be able to speak to the family on the phone, and it would be unnecessarily impacting another colleague's time. You are working on a care of the elderly ward and have recently been caring for a woman, Mrs. Green, who passed away the previous night. While you're sitting at the nurse's station, you answer the phone. It is Mrs. Green's lawyer, who has been informed by Mrs. Green's husband that she passed away, and he wants you to confirm this so that he can start the process of releasing her will. Rank and order the following actions in response to this situation. 1 equals most appropriate. 5 equals least appropriate. A. Ask him for a number that you can call him back on to discuss the matter further. B. Confirm that Mrs. Green has died, but do not disclose any medical details about her. C. Give the phone to the nurse in charge so that she can sort the matter out. D. State that you can neither confirm nor deny her death or that she has been treated in the hospital, as this would be breaching her confidentiality. E. Tell the lawyer that she died last night, but as you have not signed the death certificate, he will not be able to release the will until it is formally confirmed. Answer: ADCBE. The best thing to do with phone calls from people whom you do not know is to take a number and call them back so that you can verify that they are legitimate. In this case, you could ask which law firm they work at so that you can ensure that the number is genuine. This way you can have important conversations and be sure that they are with the correct person. Option D is the next best course of action as, by remaining neutral, you would not accidentally disclose any confidential information. Option C is a good response if you are unsure what to do in this setting, as nurses take phone calls far more commonly than doctors and are often better at dealing with calls where the identity of the caller is uncertain. Confidentiality extends beyond death and therefore telling someone you do not know that Mrs. Green has died, B, would still be breaking her confidentiality. Option E is the worst response here, as you would be confirming that Mrs. Green has died and that you are the one signing the death certificate, therefore giving out information about both the patient and yourself.